Ó ń pọn mi lọ́wọ́ ni, mo ti pè kò gbé. Remember to shade now now. Off TV, you should read. Like not on when TV. You have tests. Okay, what should we be using that? Yeah, I'll test in time for Jennifer. That's by the test. Yes. Go for me. Not far away, boy. Sorry, me there. I did my class. What? Change your position now. I'm waiting.
Abolade Grace. Can you?
Sorry, you.
Ṣàlàáfíà lẹ wà. Ṣàlàáfíà lẹ wà. Èwo lẹ ṣe?
Ẹ ṣé o.
Èwo lẹ ṣe? Good evening, sir. Welcome, sir, Mr. Odekomi.
Hello, good evening.
Good evening, sir.
Yeah, please, can we start the lecture? I think We have, last time I checked, I think I saw only 7 of us. 9. We're only 9, yeah. I think we're about 17 now. How many of us? How many are we? Microbiology.
12 now. Okay,
12.
we are more than, we should be around 23.
23. Let's still wait for them. 23. That's 12 is 50, around 50%. Our 8 o'clock should be 8 o'clock, for God's sake. Well, we have so much to discuss. Good evening.
Good evening, sir.
Good evening, Babas.
Yes, sir. Call us, sir.
Good evening, sir.
Yeah, I think
Adúpẹ́
why?
Bẹ́ẹ̀ni, sir. Ó ti wọ 17.
All right.
Ọ̀gá mi, sir. Ẹ kúrò lè, sir.
Pastor mi, ẹ kálẹ́ o.
Yes, sir. Ẹ kúrò lè, sir. Ẹ ṣé, sir.
pẹ̀lẹ́.
Ẹ kálẹ́, sir.
Olúwa máa sọ agbára di
Yes,
ọ̀tun
sir.
o.
Ẹ ṣeun wá, sir.
Ẹ pẹ̀lẹ́ o.
Yes. Yes, sir. Yes.
Can we start now? Or should we
Yes,
still
sir,
wait?
we can start.
Yeah.
Yeah.
Good evening.
Good evening.
Good
Good
evening.
evening,
Good
sir.
evening, ladies and gentlemen. I think you need to mute your speakers.
Good evening, sir. Is
Good
echoing,
evening,
no?
Please move your speakers, eh? Good evening, ladies and gentlemen. Kaleo. Now, we are going to talk about fungi, and we are interested in fungi of medical importance. At least those fungi that cause diseases in man. All right? So those are, this area is our interest. And those fungi causes disease or infections in man is called, they are called mycosis. That's infection of fungi. So, and fungi is a very, I call fungal infection a disease of poverty, or somebody that is not very clean, because ordinarily by washing your hands, your body, whenever you have contact with plant, soil, and especially dead plants, decaying plants, sorry. If you wash your hands very well with soap and water, you are not likely to get infected. But if peradventure you have problem, you play with sand, or you are somebody who is horticulturist, you play with sands and dead plants, you are likely to get infected with fungi. So, and fortunately, most fungi of medical importance are opportunistic pathogen. That is, your immunity has to be below expectation, either due to the fact that somebody has diseases that like cancer or HIV, or somebody is on chemotherapy. You may not likely have fungal infection. But at the same time, cleanliness is next to godliness. So let's continue our story later. Kí ló tún ṣe ìwọ tó lọ? Sorry o. So, what are the general characteristics of fungus diseases? All right. As I told you, fungi that cause diseases they are generally known as mycosis. All right. And they are in they're ambiguous. They are in our environment, especially in the soils. All right. And these fungi, they are very dangerous. They are harmful to men. All right. What are the characteristics of fungi? They can cause infection of the skin, the nails, the hair, mucous membrane, lungs, deeper tissue, and organ. They can even infect brain and liver. And the symptoms are in all ranges, from mild skin irritation to severe systemic illness, especially somebody that immune is compromised, all right? Either because the person is on the drug that reduces his immunity. As I've told you, most fungi are potential pathogen, and they are menace to people with weakened immune defense, especially those that have cancer, HIV, and those who are on immunosuppressant medication. The main type of fungi of medical importance are yeast, commonly Candida, most commonly Aspergillus. Then there are microbial fungi. These are mold that can exist in both. They change their morphology in different temperature. At 22 degrees, they have one form. At room temperature, they have one form. At 37 degrees Celsius, they have another form of structure. So they are called dimorphic fungi. Those groups, you need to incubate them at both temperature, 22 and 37 degrees Celsius. And as I've said, infection usually occur during skin contact or inhalation of airborne spore, or when there is a trauma whereby the skin is exposed and they can infect man. So these are the type of mycosis and site of infection they infect and examples and properties. The superficial mycosis, they infect outermost skin and hair. Example is Pityriasis fascicolor, tinea nigra. Those are the ones that cause infection of the skin and hair. Then cutaneous, they infect the skin, the hair, and the nails. They are called dermatophytes. Example is tinea, which is common ringworm, which affects mostly the young boys who play with sand. Then candidiasis of skin and nails is also cutaneous infection. The subcutaneous infection, they infect site beneath the skin, affecting subcutaneous tissue. Example is myxedema. Another example is chromoblastomycosis. Another one is porotrichosis. Then those that cause systemic infection, they enter the bloodstream, they are carried to the brain and the liver, and they spread uninhibited, and these are very dangerous. They can cause death in women. Example is histoplasmosis, histoplasma species, then Cryptococcus species, then Aspergillus species. Then the opportunistic fungi, they usually have infect immunocompromised man or woman. Example is also candidiasis, aspergillosis, and mucormycosis. You can see these infections are interwoven. All right. Candida causes cutaneous infection. It can also cause opportunistic infection. All right. Aspergillus is an opportunistic infection, but it can also cause systemic infection when you inhale the spore and it gets to the brain, the lung, and it spreads. It's spread into the bloodstream. So I want to discuss type of mycosis. So let's discuss superficial mycosis. I think we've discussed that one. So you can read it. We've discussed with that diagram. So let's go to opportunistic infection. As I've said, they do not cause disease in healthy people, but can cause serious infection in immunocompromised or somebody that immunity is weakened. All right. So examples are below. Candidiasis. So we discuss candidiasis first. All right. As I've said, this is a fungal infection and is caused by Candida yeast, especially Candida albicans. There are so many species of Candidas, but the most common one is Candida albicans. And this is a natural residence of is a natural residence of skin. That's normal flora of the skin, the mouth, the gut, and the vagina. But if it gets to a wrong place, it causes diseases. But can overgrow and cause disease under certain conditions. So what are the common causes of that promotes Candida infection in women? overuse of antibiotic, use of immunosuppressive drug, I've said poor hygiene. Poor hygiene is a major thing that makes people get candidiasis. Type and common locations of candidiasis. The most common one is oral thrush, which is oral candidiasis. And this is a white patch redness and soreness in the mouth or throat. Hello, can you hear me? Can you hear me?
We can hear you
Yes,
now,
sir.
sir.
We can hear you, but different thing on the screen. There is different lecture on the screen now. I'm seeing laboratory quality management system.
Same here.
Yes, sir.
Don't worry, I will. I'm trying to sort it out today.
Yes, sir.
When there is so many. I think our lecture is back now. Hello?
Hello, sir. Yes,
Hello?
sir. It's back.
Sorry.
It's back.
Sorry. Lots of okay. We said we've discussed this one with that. Then we've discussed vaginal candidiasis. Then let's go to cutaneous candidiasis. Cutaneous candidiasis, as it has shown, is a candida of infection of the skin folds, especially somebody that is obese, and it's also is usually reddish, itchy rash. All right, it's usually found in underarm, groin, and under the breast of obese patient. And when they are scratching, then it can affect the nail, and it can also affect the corner of the mouth. Then invasive candidiasis, that's systemic infection, and is life-threatening. It can cause death because that means candida has spread and entered the bloodstream. and it's usually occur in hospitalized patient and common immunocompromised patient. What are the symptoms of candidiasis? As you have said, it's very itchy. So itching, burning sensation, redness of the place, rash, and soreness, depending on the location. And if it's in the mouth, there will be white patches, thickened white patches, and it can also cause discoloration of the nail. In severe cases, it can cause fever and chill, especially when the infection is systemic. So the next mycosis we are discussing is a phycomycosis, also known as zygomycosis or mucormycosis. These are rare group of fungal infection, all right? And they belong to the class phycomycetes, and the common ones are mucorrhizopores and abscidia. They usually occur in the individual with weakened immune system, all right? And especially those people that have chronic illness like diabetes, leukemia, and those people that on immunosuppressive drugs. Type and causes, as I've said, is caused by mold, Odamucorales, mucorrhizopore abscidia, and entovituralis, e.g. Basidobolus and Conidobolus. They grow rapidly and can infect blood vessels, causing tissue necrosis and blood clots. In severe cases, infection can lead to, is very fatal and mortality is very high, even when patient is on treatment. So how do we diagnose it in the laboratory? By simple microscopic examination and culture of fungi from infected tissue. Then imaging can also be done by assessing the extent of invasion. The treatment antifungal commonly used is amphotericin B because it's a systemic infection. And sometimes surgery can help to remove infected tissue. So what are the things we can do to manage it? We must control diabetes. And this is very important for best outcome. So let's discuss sporotrichosis. This is a opportunistic fungi too. It's caused by dimorphic fungi, Sporotris shessinki, all right? It's found in soil, decay wood, plant matter, and rose bushes. And because of this, it's usually called is nicknamed rose gardener disease. So it usually infect man through minor cuts, especially of the skin, puncture during outdoor work, especially during gardening, farming, or handling of plants. What are the forms and symptoms? The most common form is cutaneous skin sporotrichosis. Present as small is painless bump with nodules that may oscillate and follow a line along lymph channel. You know, when it's something follow line, infection follow line along lymph channel is very dangerous. Over time, the nodule may appear on the affected limb. And in rare cases, it can cause lung infection, usually called pulmonary sporotrichosis. All right. And these symptoms is similar to that of tuberculosis, cough and chest pain, sometimes night sweating. And it can also cause disseminated sporotrichosis, which affect the blood so that it does affect the bones, the joint, and the brain, especially in people with weak immunity, such as people with HIV and AIDS, and those people that take excess alcohol for a long time, alcoholism. Diagnosis and treatment. So it can be confirmed by examining the skin scraping or biopsies or by culturing the fungi. The best form of identify fungi is microscopy and culturing. We treat laboratory diagnosis of fungi too. The primary treatment of sporotrichosis is itraconazole for several months. In severe cases, you use intravenous amphotericin B, and it can be followed by long-time use of oral medication, which is itraconazole. So how do you prevent it? By wearing gloves and long sleeves during high-risk outdoor work. Another opportunistic infection we are treating is chromoblastomycosis. It's a chronic infection of the skin and subcutaneous tissue. And it is a pigmented fungi. And since it's infect the skin, is dermatitis. That's common source of infection is from the soil, as I've said, and decaying vegetation. And the infection is similar to that of the previous one. And it's often affect people that walk barefoot in the house or in the farm. And due to close contact with the soil and plant, especially in tropical area, one can get infected. So causes. The common causative agent is Fonseca pederosol. Another one is Clodophalophora carionin. Another one is Phallophora verrucosa. Those are the common organisms that cause those infections. So when there is infection occur when the fungi implanted on the skin, especially on the leg, or any other exposed area of the body, especially when somebody has injury and it came in contact with plant materials. And the infection starts small, painless, reddish bump with papullae at the site of injury. Gradually, it developed into hard, wart-like or cauliflower-shaped lesion that can become ulcerated and itchy over months or years. These lesions expand slowly and form a large nodules. And in advanced cases, swelling, scarring, and then bacterial infection enters, which lead to difficulty in movement of the affected limb. So in chronic cases, it causes lymphatic blockage and rarely malignant transformation. How do you diagnose this? Laboratory diagnosis is by skin scraping or use of biopsy, skin biopsy. And the biopsy under microscope shows characteristic brown multicell fungal bodies, usually called sclerotic bodies or copper penny bodies. Culture can also assist in diagnosis. How do you treat it? You can treat it with itraconazole or tabivine. And surgery can help, especially cryotherapy, whereby the site is frozen. Early intervention of this infection gives best chance of cure, while advanced cases are harder to treat. And if it's harder, it may cause long-term disability. Tuberculosis is considered a neglect tropical disease, most commonly affected outdoor workers. So let's discuss aspergillus. Aspergillus, the most common aspergillus in this environment is Aspergillus fumigatus, all right? And is worldwide. It's found everywhere in the soil, in the organic matter, green and indoor environment. It has over 250 species, all right? And is very significant to medicine, agriculture, and industry. The human aspergillosis is a dangerous infection. And it infects people by inhalation of the spore. Especially it manifests very well in people with weakened immunity. So there is invasive aspergillosis in men, which is life-threatening lung infection, and it can cause allergic bronchopulmonary aspergillosis, which lead to hypersensitivity reaction. Aspergilloma is a fungal ball, usually in the lung. It can also infect the skin, the hair, and the hair of man. How do you diagnose aspergillus infection? So you can use conventional method is the use of microscopy from specimens such as blood, sputum, and tissue. And you can stain it. The common stain we use is I will remember. Let me continue. And you can also culture it. You can also culture it, but sorry, I've moved from opportunity infection. Sorry, there is a mix-up. Sorry, my people. We finished, the last topic is Aspergillus fumigatus. So the next lecture is opportunist fungi laboratory diagnosis. Sorry, there is a mix-up there. So how do we diagnose all these opportunist fungi? That's the second lecture today. And after this one, we call it a day. It's not much. We do laboratory diagnosis, and then we do chemotherapy for. Then tomorrow we discuss systemic fungi infection. So let's start with opportunist fungi laboratory diagnosis. I hope you are following me. Hello? Hello,
Yes,
class.
sir. Hello, sir. We are following.
Okay, Baba.
Yes, sir, we are hearing you, sir.
Okay, I think before we go to laboratory diagnosis, can I have some question on introduction to fungi, then opportunistic fungi? Can we ask? Is there any gray area we want to ask questions so that we explain further? Hello? Is there if there is no question?
Hi, sir. Move on, sir. No problem.
Okay. Opportunity fungi laboratory diagnosis. This is very important, especially for patients that are immunocompromised. And we can use both traditional and advanced method. The aim was for an accurate detection to guide treatment. So, and the conventional traditional method is a microscopy method. So we can use blood, sputum, tissue, skin scraping, ear, nail to diagnose opportunist fungi in the laboratory. And microscopy, as you well know, is the key method for quick detecting of fungal infection. And the presence of fungi cell can be seen under the microscope. And this is often the first step in diagnosing fungal disease. So what are the steps you will do in microscopy? First step is mounting and staining. All right. You can mount on the specimen on the slide. All right. In most cases, if it's skin or nail or hair, you can add potassium hydroxide to digest human cell. All right. it will clear the ground and making the fungal elements available for observation. And you can identify the fungal element with the IV and other things like yeast cells, the shape of the yeast cells. And these are easy to see under the microscope. You can also use chalcofluor white stain. This is a fluorescent dye. It binds to fungal cell wall, causing fungi to glow under, and you can observe it under UV light, ultraviolet light. And this one have improved sensitivity. You can use Indian ink too. Indian ink is mostly used in diagnosis of cryptococcus from cerebrospinal fluid. And it highlights the thick capsule surrounding the yeast cells. So there is another stain we use in the laboratory. I will remember before the end of the class. Then you can use histopathological stain for tissue section. And you use special dye, periodic acid shift, or gomori metamine silver, which highlight the fungal element. And with this, you can also view under this microscope, and you can see the vast shape of the yeast, the branching of the filament, the pseudohyphae, the spore, and pigments of the cells. And this serves as the morphological clue. It serves as a way of identifying fungi, because each fungi species have a specific mode of morphology. All right. So the appearance and arrangement of fungal structure helps suggest the type of fungus. For example, septate with division or non-septate or pigmentation. They have a way of identifying fungi with their septate, whether is segmented or not segmented. Why do we use laboratory diagnosis? Finding fungal element in a sterile body site, e.g. blood and tissue, is a strong proof of infection, especially in high-risk patients, such as HIV patients. Then we can do culture. The common medium we use for culture in the lab is sabrode agar. That's what we use commonly, but there are so many other media. All right. And culturing is a gold standard. Although it's slow, it takes weeks, and sometimes it's less sensitive. But if you are able to isolate, you can do antifungal susceptibility testing. Once you identify and do culture and do antifungal susceptibility testing, you'll be able to treat the patient infection very, very well. Let's go to modern molecular techniques. The modern technique is serological technique. Antigen detection, such as galactoman and BD-glucan tests. These are quicker, more sensitive results than culture. They are important for invasive infection like aspergillus. However, you can have false positive and possible clinical correlation is essential, so that you use your laboratory diagnosis with your clinical diagnosis to arrive at certain reference. Molecular diagnosis. You can use molecular diagnosis to detect fungal DNA directly from clinical specimen. The common PCR method can be used, and it's very rapid, and you can identify your organism within 6 hours. And it's also highly sensitive, highly specific, and you can identify species to species identification before fungus has grown in the culture, so it's faster. But the bottleneck is that it's very, very expensive. Molecular method, but it's faster. You can take care of your patient as soon as possible. When you have your result, and patient will be better for it, but it's quite expensive. You can use Maditov. I think we have this one in microbiology. You can use it for yeast identification too. This method is also rapid, very specific, and you use it with clinical sample. All right. Although it's often used for candida species, it's less developed for mold. You can also use lateral flow assay. This is a point of care immunochromatographic test. This will quickly identify the fungal antigen in serum or respiratory sample, especially is used for Aspergillus and Cryptococcus. It's also highly sensitive and highly specific. So how do you interpret your laboratory results? So as I've told you, you need to combine your laboratory results with your clinical results, especially in high-risk patients. So let's go to chemotherapy for opportunistic fungal infection. So this use of antifungal medication in serious infection that is caused by fungi, mainly that affect people with weakened immunity, such as those with cancer, HIV, or who are on immunosuppressive drug. They are main class of antifungal drug. Polyhins, the example is amphotericin B, is a broad spectrum drug and is used for life-threatening infection. It has a lipid-based formula. And let's talk it to kidney. Polyhin work by binding to fungal cell membrane, causing them to leak and die. Then the second class we are treating is azoles. And these are examples of such drug is fluconazole, itraconazole, fluconazole, and posaconazole. They act by blocking synthesis of fungal cell membrane. They are used for both preventive and treating of fungal infection, such as Candidiasis aspergillosis, but some fungi develop resistance to azoles. Echinocandin, this is another type, including caspofungin, micafungin, and anidulafungin. This drug inhibits synthesis of fungal cell wall component, are effective against Candida aspergillus too. Then flucitozine. These are other agents often used in combination with amphotericin B, especially for infection like cryptococcal meningitis. What's the principle of antifungal chemotherapy? Choice of drug depends on type of fungus, infection and infection site, patient immune status, and possible drug resistance. Therefore, you need laboratory tests to match fungus with the best treatment. So laboratory is used to determine which type of drug you use. So the treatment, the time for treatment may last for weeks to months. And you can use oral, intravenous, or even intrathecal, that's spinal injection for severe disease. Let's discuss toxicity of chemotherapy and monitoring. Antifungal, especially amphotericin B, can cause side effects such as kidney, liver, or blood toxicity. Therefore, regular monitoring of organ function is needed. So when you are using this drug, you need to monitor your liver, monitor your kidney because of the toxicity, all right? Because this is a drug you take for months, sometimes 6 months, sometimes 1 year, and it affects this very important organ. Combination therapy. In certain severe or mixed infection, more than one drug may be used to improve outcome or overcome resistance, although this can increase side effects to the patient because there is increased toxicity. Can we use fungal drug for prophylaxis? It can be used in high-risk patients especially those on stem cell transplant. These antifungal drugs can be given preventively to reduce infection risk. So we are able to do 2 lectures today. Tomorrow we'll continue with systemic fungi. All right. But before we go, do you have questions? Question. My people, question. Hello.
Good evening, doctor.
You are welcome.
Thanks for the
You have question for the
sir. Yes, Oga.
Hello, sir.
Fluconazole is not more working for yeast infection nowadays, sir.
What do you say?
Fluconazole drugs is not more working for the. Yes, nowadays.
There is resistance now.
Yes, now there is resistance.
I've told you. That's why sometimes you use combination therapy.
Okay.
What you should know is that if peradventure for sometimes a drug is resistant, 10, 15 years later, and because if you stop using it for sometimes later, maybe 10, 15 years later, it still works. It still be.
All right, sir. Thank you, sir.
I'm not hearing anything.
I'm not hearing anything too.
Maybe it's what network, Oga.
You are right. My internet has been unstable since.
Yes, no, it's network.
The internet have thrown him out of this platform. It's not even working.
But he said he's done with today's lecture.
It's no more in the. It's not has come.
It's like I said, we have come to the end of the lecture. Want to sort a letter?
Yes, so since his network tripped off, so he decided not to come back again since he's done with today's lecture.
So we can call it a day. Tomorrow, by God's grace. So.
Please, who is the class rep here? The class rep should contact him now.
Hello. We'll all meet tomorrow, same time, 8 p.m. So we'll call it a day. We can call it a day now. Thank you.
All right. Good night. Sir. Networking.
Give meeting time.